Jeremy Camps and Trixie Kyoko. You're a husband and wife team who are developing a new play called Skin to Skin, produced by Houses on the Moon Theater Company. And I've had the privilege of hearing the first two readings of the play that focuses on the birthing experiences of three African American women in New York City today. But what really struck me in the play was the story of J. Marion Sims, a 19th century American physician, often called the father of modern gynecology, who controversially develops surgical techniques by experimenting without anesthesia on enslaved black women. Kind of echoes of Nazi doctor Josef Mengele. And his statue stood in Central Park in New York until 2018. So your play, you bring this Sims legacy into the present with your play. And Jeremy, you're the playwright, and Trixie, you're a certified nurse midwife with considerable clinical experience that strongly informs this play. So let's start with how you two conceived of the play. I'm really interested in hearing what conversations did you two have that led up to the play. I can imagine you coming home from work and telling each other about your day, and I was just wondering what you talked about that led up to this play.
Well, I mean, I'm sure we have very similar kind of idea about the conception of this, but the way it began for me is I am a major externalizer. I talk a lot. And that's how I process. I don't journal. I don't see a therapist. And so this work, it's a lot. It takes a lot out of you. You pour a lot of yourself into people's lives. A lot is poured into you, and that has to go somewhere. So for years, I would come home and share these stories with Jay. And it was just, he has such a brilliant mind. And I think the fact that he's a playwright allows him to really be able to find like empathy and connection to things, even if he hasn't directly experienced them. And so he was just a great person to like share with, talk about, reflect. And one day we just kind of like, wait, why don't we create this story together? Like the stories that I'm sharing and what I'm going through, they're important and they need to be heard, especially from folks who are not actively experiencing them or in the medical field, like beyond those spaces. So that's how we begun.
Top. Yeah. Writing is also the conversations we have, the way we engage with the world. So I think we started writing it in that respect from very early on. And then I don't know if you said this or I imagine it, but Trixie had said something to the effect, if I was writing a play, this is what I would write about.
Right.
And that fits with
Yeah.
sort of a creative view that I have or a feeling I have about the arts and theater and specifically in that finding ways to partner and move beyond sort of the theater walls and use it to reach out and pull within, pull together, is something that I really love about theater and sometimes not happening to the scale or the amount that I think the art needs and the art promises. And so, I think there's validity, and I've done this where I am interested in a topic that doesn't have much to do with me. And then, at least on face value, I research, I enter that world, and a story emerges.
Tony and I were both saying that we see your play as definitely a form of resistance, because you talk about the disproportionate number of Black women who die in childbirth. And it's interesting because the figure used in the play was 8 times higher than the national average. And I said, well, I thought it was 3 times higher. And Trixie said, nationally, yes, but in New York. And that was very shocking to me. So I think in addition to being a part of the discourse and collaborations and sharing and all of that, I think too, to some extent, this is your way of kind of pushing back and resisting against the current administration's cutbacks and things that really affect the maternity wards and the births going on all across the country. Would that be fair to say? Or?
Yeah, I 100% agree with that. I think that especially for me as a provider, there is a feeling of like how big the scale, the enormity of this crisis is, and this kind of feeling of like, what can I do to like somehow rectify this, dismantle the system that's essentially perpetuating and creating this crisis, right? And I know that I'm doing it on the most granular level as a provider, as a midwife. But there was a part of me that understood that as humans, we need story. And my experience, that people, both as a midwife and as a Black person who has birthed in America, is and help people who aren't in this space understand it is through story. And so I felt like this was a great way to uh, give a little like resistance to, yeah, this bigger.
You know, we definitely get a hint as to what you're resisting against. So I was wondering, Trixie, as a mother and also as a healthcare provider, um, can you provide some details, again, without violating HIPAA or anything like that? What are some specific things that you have witnessed both as a mother and a healthcare provider that led to that led to this play? I mean, statistics are one thing, but there's the story, the qualitative story behind the statistics that are equally important, if not more so, because they tell a story. What were some of the things that you've observed as either a mother and as a healthcare provider that informed this play?
So one of the things that I at least felt what we were using this play to resist against is essentially this hierarchy in medicine
Hmm.
that informs the way medicine is practiced, whether it's in obstetrics or in other disciplines. So on a very personal level, one of the things that I see all the time is this idea that like the provider, and I'm going to use, unfortunately, physician at this point as kind of like to identify the provider, right? This idea that the provider is a know-all, be-all, and that's it, period. And so a lot of the times in hospital spaces and clinic settings, you find that the person, and especially in my field, the woman, the birthing person, what they believe about their body, what they know about themselves, what's important to them, their values, those things are disregarded for the sake of the providers, like their opinion, their interests. And so one of the things that I was really wanting to resist was this hierarchy that exists. And I want to dismantle that. And I want people to know that like it actually doesn't have to be like this at all. And one of the things that we actively chose to focus on midwifery as part of the play. Obviously, because I am a midwife, but also because the midwifery model of care does actually have very different tenets relative to the obstetric model of care. And one of those is like this idea of like there's no such thing as like the pyramid where the physician's at the top and then everyone else comes after, and you can rarely find the patient anywhere in that pyramid, right? And if you do, they're likely at the bottom because they don't know anything to add, they have nothing to add. um, so the midwifery model of care really asks us to actually undo that altogether, and it says we need to recenter the patients, and we need to bring them into the fold, and we need to recognize that people are experts at their own bodies, and they have some intuitive knowledge to contribute to their care. And so I felt that that was a really important something that I really wanted to showcase, and it came from these experiences that I was seeing in office spaces and hospital settings.
Right.
Yeah.
I think your character of Janae, I believe, she kind of expresses this when she's, kind of telling the doctor that, her legs are swollen or that she's not comfortable leaving the hospital. And the Dr. Bonner, who is a white female doctor, right, tells her, it's time for you to go and you can come back in a couple of days. And she refuses. And then right away, the default response is, well, then I'll call security. And she's like, well, then bring it, if you're going to call security on a pregnant woman. But that seems to be the default of, I mean, I think it does have to do with Dr. Bonner seeing Janae as kind of a being out of line, disrespectful to her, whereas the who resolves that situation is the a young Black midwife who comes in and says, okay, no one's calling security on anyone. And she just kind of brings it, she just grounds it right back down to a very human level.
The play really brings up, in many ways, more than just the African American experience. For me, I'm speaking in terms of my understanding, what it did for me, having worked as a medical educator for about 35 years. I understand what you're talking about, the hierarchy that is ever present. So, in many ways, I also see this play as not only about hierarchy, but about gender as well as race. Gender is a huge issue in this play, as far as as far as I can see. It's not only it's again it's not so it's bigger. What you've written is really system wide in so many ways. There's so many different systems that are impacted by this. And
Right.
so the big question for me comes up, how do you change the system?
In your position, Trixie, you're not going to walk away from a system of women who need you. So
Right.
what other kinds of resistance? Maybe just being a midwife as opposed to working in a traditional.
But the midwifery model of care is very antithetical to the obstetric model of care. And so I think there just needs to be a complete deconstruction of the way we perceive medicine in this world, in this country, and how we practice it.
So this play is confronting white supremacy that is framed that in that institution, and capitalism that's framed that institution. And those two things function and feed and flourish based on subjugation, dehumanization. And so that I think if that's not a fundamental belief and accepting capitalism as part of that.
I wanted to challenge a bit this idea of rhetoric. The rhetoric that comes, let's say from the right, as well as the rhetoric that's coming from the left. And, specifically, I'm thinking about terms such as patriarchy. That's a concept. And so I'm wondering about the rhetoric used by the left that's completely justified in terms of trying to, address some of the historical problems of the past. Does the rhetoric sometimes of the left um, interfere with people listening and changing their minds?
That's a
Like, for
great
example, in your play, I don't know that you really use that language, but to me, when I hear patriarchy, being a man, being a white man, it bothers me. But I can both understand what you're talking about, but I also want to reject it at the same time. So the rhetoric of the left is as problematic sometimes as the rhetoric of the right. So I'm wondering if you can
Does,
address that, what your thoughts are.
does you reject it? Does it feel reductive to you? Or
Yes.
Okay.
Yeah, it feels reductive, and I understand the issue of labeling something that's a problem, but it does feel reductive.
Yeah.
Not every man stands at the top of a hierarchy, and we're seeing loads of pushback by men in the society that feel left behind. They're white and they have lots of excuses for what the issue is. But I worry as much about the rhetoric from the left as I do from the right.
So I actually really love that question, and I love that you asked him why it felt because for me, when I hear those terms, what I kind of like recoil at is the academic component to them, or like they're a little bit like, for lack of a better term, they're a little bit abstract and not as
Right.
uh you can't like they're not part of our vernacular. And
Right.
so it's hard to understand, what does patriarchy mean, and what does that have anything to do with Black women dying, right?
Right.
So I think, to answer your question, I am also someone who's a little bit like, yeah, I think that there is something to be said about the language that's being used from both sides, making it less difficult for people to access, this information, or be open to, learn more about. And I think that's one thing I really love about our play is it took stories again of lived experiences, and not just from like some textbooks that we read, or it was from
Yeah.
my lived experiences as a midwife, and for a composite of women that I've and birthing people I've cared for. And we really wanted to make sure that it felt like, yeah, this is the story of a person's life, and it is accessible and understandable, and some you can connect to it no matter what side of the aisle you're on.
I
Yeah, and
have
I didn't feel reduced by your play. I've seen two
that.
readings of it so far. I really didn't. I felt extremely informed, but without the accusation that I'm part of the
Yeah.
patriarch.
Well,
Uh, so
I
that's the
also,
power of stories. That's really important. That can do things that rhetoric can't do.
it's just reiterating what Trixie and you just said, Tony, is like why we chose it as that. And I know we kind of framed it as resistance and political theater and epic theater and some of these things, but it's really not that. It's stories, it's characters, and as much influenced by a legacy of writers who write about character as when I mentioned Brecht earlier, and believing that if we just sit with these three stories and know them as people, that does a lot right there. That does a lot of the work.
Here's another challenge to this notion of stories as being powerful. Not everyone thinks in stories.
Mm.
Some people do. It's not a universal thing, I think, but for the most part, people do. But not everybody is persuaded by stories. Not everybody lives their life in terms of a narrative. It's something that we want to believe as people involved in narrative and in plays. So it makes me wonder, and I completely agree with what Sue and you guys are saying about the power of this play. I mean, these are three individual women. They're not perfect. I love stories, and so therefore it had an impact on me. But not everybody is like me. Not everybody buys stories. They think in other ways. So it makes me wonder, what do we do for people that don't think the way that we do and don't think in terms of stories?
The people who understand story make policies for the people who don't, and they just have to follow those policies. Like, if that's the case, then you're gonna do what the policy of your workplace is, the policy of your government. So there's enough of us who do that we can make policy, and for it. So if that story doesn't translate into, oh, something about me or the world or in the way I interact with it should change. For those who need to, like they're not assuming that everyone is. We're talking about people that may see a play like this or stories about this issue or others in medicine that maybe we're hoping shift, right? So in that case, if they don't see it after that, maybe our play isn't good enough or perfect enough for it, but they see some other thing that like they see these things, they know them, they know the stories. I think then, yeah, then they're human, they're in society. The other alternative, I'm sorry to say, is just then we'll make policy that
Yeah.
changes, and then their behavior will change and their way of seeing will change.
Well, you bring up a really important point, Jeremy, that narratives are not just stories. They're embedded in policies. They're embedded in regulations. It may not be a literary story,
Yeah.
but it's another way that we have of telling what we believe in. Can't wait to see this play in action.
So the first answer to that is, it's all being determined. We were supposed to do this in 2026. We're looking for co-producing partner to give it a bigger platform and a longer showing in maybe the more conventional off or off Broadway sort of ways that theater is produced in New York City. or
Mhm.
maybe a regional theater that's similar in the way that's produced.
Mhm.
But also seeing that as a springboard to something greater. This seems like this is something we could, in the tradition of and like I said, this is all to be decided. So some of this is the dream that we've shared. Um, if you're familiar with Shakespeare in the Park's history, before it had a beautiful theater in Central Park, they performed it out of the back of pickup trucks all around the city with the idea that it's a living library and everyone should have access to it. So some version of going to different communities, some who may be like, I've experienced this and I'm looking to understand and heal. I'm looking to not be alone. Some who are like, I have no idea what this is about. Um, and I'm open to confronting it and reckoning with my ignorance or my implicit part in this. Some maybe communities that you work with, in sort of the medical field. Students, so many people in two reactions that I think are instructive of many that we've had in our stages of development. One, former student of mine, a white man, he's 19 years old. He saw the play and said, "I am going to call my mom right now." And another response that was not only this person, but one of the women in our workshops, actually, this was two or three people who said something similar, said, "I didn't track as what happened to me
Yeah.
as being the
Yeah.
way I feel about it now until I had this space to talk about it, to tell the story, to enact the story, to mesh our stories together and see that we're part of a similar story, see my story and your story and vice versa."
Yeah.
So I think that it being an epidemic, um, finding ways to have it meet the world and not just, see who can afford the ticket and is free a few weeks in March. So hopefully we have some room for that. And I think there's a component too that I could dream of where there's like a weekend conference, whether it's medical practitioners or other places where you could perform the play in 3 different acts, not all together.
Yeah.
So you perform it and you maybe have a few discussions in between and whatever it may be. And over the course of the weekend, you've seen the whole play and it becomes a sort of anchor or reference point for other things you want to discuss in whether that's professional development or community building. So I see a lot of possibility for it. And even the way it's written, I am comfortable just doing one act if that's what people see, or just one of the 3, because it's written as 3 different threads and they have their full arc. But they also, each scene is its own, to me, short play.
Brought up. The idea in narrative medicine is, to look at a text and then do deep dive into a reflection on what we just experienced.
Mhm.
That's really key, I think, to making an impact. Maybe not just the play, but the reflection upon whether they're individual scenes or the whole play itself, having a discussion, because it's through art that our biases become manifest. Like, for example, if you're asking someone to consider their racist attitudes and you do that directly, you're going to get a big pushback. However, if you expose them to stories
Yep.
in which they can then
Yeah.
reflect on what they just heard, those biases could come out in a conversation. So it's a much more efficient way. So it's an indirect way of getting to what you want to get to.
Right, because we've shared something, so you're a community, and so now instead of throwing around terms that may be off-putting to some,
Totally.
you're talking about Janae, you're talking about Araceli, you're talking about Hazel, which are the names of the 3 women in the play, and it's rooted in that, and it's less about we're talking about so many of these
Abstract.
we think we're in the same discussion, but we're really not. Whether it's Thanksgiving table or Congress, it's like these are 2 people talking, 10 people talking about 10, 15, 20 different things.
Yeah.
So having a story is the anchor, is the shared experience.
One thing I'm always interested in terms of writers and artists, it's been said that the artists and writers are the last people that understand what they're really writing about.
Hmm.
I'd be really curious, you know, uh, for you, what it would be like to hear people's reaction to what you're writing. It may give you an additional idea of what has come out of you because, you're producing this from the inside out.
Yeah.
And I think artists like you are creative, both of you. But you may not grasp the whole picture yourselves, which I think what we do in narrative medicine is try to expand the picture, even for the artist.
But something, Tony, you just said reminds me of after we did that public reading that you were at, someone came up to me afterwards and said, look, like I've never had children before, but I had an abortion in my past. And there was something about this play that just brought me right back to that place. And there was I feel like there was like, there's healing to be done
Mhm.
that this play like allowed me to like begin to access. And never did I ever think that that there would be that link, right?